Hello and welcome everyone to our panel discussion on Asian hospitals' flurry to adopt telemedicine. But before we start, I'd just like to make a few announcements. Feel free to ask questions at any time by typing it in the chat Q&A chat bubble, which you should find at the bottom of your screens. Kindly mention which hospital or organization you're from and what you do, basically your job title. In the interest of time, we won't be introducing the panelists and the moderator at length, but we do have their bios if you click the link in the chat box. This webinar is recorded and will be made available in our HMA and HIA websites. Now, before I turn you over to the moderator and our panelists, I'd just like to do a quick poll just to find out where we are all at in terms of telemedicine or telehealth. So here, have you used telemedicine or telehealth before? Yes, as a patient, yes, as a clinician, yes, as both, or no? Okay, I'll just wait for everyone to vote in. Thanks very much for participating. All right, is that everyone? Okay, I think, hang on. All right, that's it. Okay, some people are still voting in. Just give you a few more seconds and let's end the poll and share the results. There you go. So we have a lot of you not have experienced telemedicine or telehealth before. That's good. So you're in the right panel discussion. So let me now introduce to you our panelists first. First of all, we have Dr. Jeff Staples, Chief Operations Officer of United Family Healthcare in Beijing, China. We also have Pak Ryanto Tedjomulja, Chief Information Officer of Siloam Hospitals in Indonesia, and Mr. David Boucher, Chief Business Transformation Officer of Bumrungrad International Hospital. David? Hang on. There you go. That's David. Hi, David. And finally, our moderator for this afternoon, Ms. Grace Park, co-founder and president of DocDoc Private Limited. Over to you, Grace.
Great, thank you for this opportunity to be your moderator today. Telemedicine is one of the hottest top of mind topics as COVID-19 has accelerated digital health adoptions. Patients are expecting efficient and effective solutions without needing to go out of their homes, especially during lockdowns. But now that patients have experienced it, are liking it, telemedicine being the lowest hanging fruit to taste in the realm of digital health, this new habit seems to be hardening as the new norm as we move into the post-lockdown phase. So before we go straight into our questions to our panelists, I just wanted to mention again to our audience as you're joining this call, just reiterating what Pinky just shared, feel free to write in your questions so we can incorporate them throughout our next hour together. Alrighty, so to kickstart, as there may be varied backgrounds on this topic, and we just saw from the poll a limited usage of telemedicine thus far, would you, David, help to define the difference among telehealth, telemedicine, and telecare, as these are typically used interchangeably?
Yeah, great. Great question. Thanks, thanks, Grace. And again, I'd like to echo what Grace said. Thank you for all the participants. We have a huge crowd today, so hopefully we'll have some good questions. To me, as I think about, I've been involved on the provider side with telemedicine and telehealth since about 2015. So telehealth to me is a catch-all term that refers not only to telemedicine, along with the broader scope of non-clinical things like provider training, grand rounds, administrative meetings, things of that nature. At Bumrungrad, I can share that this has included grand rounds with a number of hospitals throughout Thailand for a number of years. So we would consider that a telehealth application and stuff. But for us, as we'll talk about during the conference today, certainly during the times of COVID, that has morphed into a number of really, really interesting ways that we'll share a little bit later. Telemedicine to me refers specifically to the remote clinical services, if you will, um, such as direct-to-consumer acute care, primary care services, teleradiology, things of that nature. And then teleconsultation, to me, I think is a more general term for any consultation between doctors, doctors and patients on a network or a video link. And to me, from a high level, that would include things like FaceTime, Skype, internet, email, and things of that nature. So I think we would all agree on the phone, on the participants, that there is not one set standards of definitions worldwide for this. And especially with the advent of COVID, it's morphed into a lot of very interesting areas. But I agree with you, Grace. I think it's going to continue to accelerate.
Very good. Thank you for that very clear definition. That's very helpful, so we could establish a foundation in terms of when we speak through each of those terms. So moving on to the next question, would you each share about your telemedicine solution? Because not all look the same. And so if you would distinguish if you offer telemedicine or telehealth or any derivative, what are the basic offerings and any other additional offerings to your services, such as medicine delivery? Or I see a question that's come through talking about remote patient monitoring. Maybe that's part of the telecare process or capabilities. Any other offerings you have offering as services? And also if you could elaborate how it was set up, whether it's in-house or with the external telemedicine company, and if you could touch also upon your business model. So let's just start with Dr. Jeff.
Okay, great. Thank you, Grace. And David, thank you very much for that introduction to the topic. I would say United Family and China, and specifically in China in general, is fairly well advanced with the whole telemedicine and telehealth function. We at United Family have been doing what David defines as telehealth for quite some time, with CMEs, conferences, grand rounds, following up on patient care with colleagues, et cetera, management meetings, obviously accelerated by the virus, but we've been doing it for quite some time. On the telemedicine front, I actually would probably add another component, which is the, I don't want to say the digital sales and marketing, but really we are very advanced in our digital sales and marketing, working with the digital platforms. And we also have a patient portal, which is probably our key entry point into the patient and our key mechanism for interacting with our patient on a daily basis. In the patient portal, we have laboratory results, we have scheduling, we have bill paying, we have consultations, we have information. We can send out educational information and promotions as well. We had been talking about the telemedicine, actually the teleconsultations with patients for quite some time, as had many people. I think this virus has accelerated that significantly. We have implemented group-wide teleconsultation policies, procedures, and enabled each of the different hospitals. We have 7 hospitals. Each of the different hospitals is able to either work with a private vendor or develop their own platform. And right now we're doing a lot of telemedicine consultations with patients that is largely free of charge. We have not yet found a way to effectively monetize that. Insurance companies in China have not yet agreed to pay a fee for that. And right now we're more concerned with providing access to care for our patients who are maybe hesitant to come to the doctors than we are in actually monetizing these transactions. I think the future is the expansion of the services and the monetization. Right now, it's really, we're really focusing on providing access to care.
Very good. That's very helpful. Thanks, Dr. Jeff. Let's move on to Pak Ryanto.
Thank you, Grace.
Yes.
And thank you, Jeff and David, for sharing. So let me talk a bit of our journey with the teleconsultation. I would say Siloam Hospitals in Indonesia is the new kid on the block between these 3 panelists. We started implementing our teleconsultation services barely 3 months ago, right? So mostly during the COVID period. This is something that we've been considering for long, but like all of you said, this has been accelerated by the COVID. Now, when we look at the teleconsultation being provided out there, we see many different models, right, for this. Some are providing the teleconsultation on demand, where there are doctors on standby 24/7. Some providers are providing appointment-based teleconsultation. Some are providing GP consultations, while others are providing specialist doctors consultation. And the payment models are also very different one to another. Some are applying pay per transaction model in Indonesia, and others are using the subscription model. While when we consider the right model for us, at the end, we decided to adopt a model where we're focusing on specialist doctor, right? And it's provided appointment based, so people can see the available schedule, and then they make the booking ahead, and then they make the payment upfront. And what we're doing is we apply online payment per transaction. And actually after that, we're also, right now, we're serving mostly out-of-pocket patients. Some of our customers also are corporate clients, but we're working with insurance in Indonesia on teleconsultation to be able to cover some of the fees as well.
Very good. Thanks so much for, it sounds like during the COVID, you accelerated the growth of all of this and support throughout establishing it during the key time period here. Thank you. Let's move on to David.
Sure, thanks, Grace. I'll start at a high level, from a basic to a more complex level of telehealth here. I think there have been email exchanges going on between physicians and patients. I was going to say eons, but it hasn't been around that long, but certainly for over a decade now. And it's almost impossible to regulate that. So that's one level of exchange of, give and take between patients and physicians. We launched, Bumrungrad launched a direct-to-consumer primary or urgent care mobile app in May of 2019. And basically from a business perspective, the patient goes to the app store, they go to our website, download the app, they pick a physician out that they want to see. We have a payment mechanism in it, and they can either the physicians can charge what they want if it's going to be an extended teleconsultation, but generally the basic price is about 500 baht, which is about maybe $15, which is well below cost, of course. And it's generally for things like that lend themselves to physicians not laying hands upon. So think in terms of sinusitis, conjunctivitis, things of that nature. And I think that almost immediately, within about a week, that morphed into pre-surgical and post-surgical consultation with physicians. Specifically, or initially with the orthopedic group, they start saying, well, this would be pretty good for us to have for patients flying into Thailand and stuff. And we'll talk a little bit later during the session today. Certainly during COVID, it's morphed into a number of different areas as well. But we initially started out with a direct-to-consumer and a secure mobile app.
Very good. Thank you so much, David. So we'll actually review the chat for any interesting questions that. Okay, and we'll continue on with some of the questions. I think that I'm seeing some questions and related to some of the challenges, which we'll cover as well. I think one of the questions coming through is asking about maybe the setup that we have, and it sounds like it's a bit varied from our panel in regards to whether we had built in-house or had partnered with a external party. And it looks like the question from Anurad Wabble was related to do you see a clear value proposition for making equity investments into telehealth companies, or only focused on setting up commercial partnerships with vendors? Pak Ryanto, do you want to take this? I mean, you had actually moved very quickly during the COVID-19 period, just 3 months, just to be able to cater to the audience and set up quite quickly. Do you think of that in the long term of the commercial partnerships, or as an equity investment, or just really focusing on the commercial partnerships with the vendors?
Okay, so let me maybe again share our view from the provider side, right? And then how it relates to the technology needed to perform this kind of process, and then you can I guess think of whether this is something commercially feasible or not. I mean, if you think of it from the investment perspective, yeah. Now, if we think about the process to do the teleconsultation, I would say there are three parts of the process, right? One is before the consultation, and then the second part is during the teleconsultation, and then the third part would be the after or the post consultation, yeah. Now, the first part of the process, which is the pre-consultation, we have a few processes there, right? So one is a patient, in our case, right, downloads a mobile app, which we are working with an external partner to do that. Then they'll be able to see the doctors available, the schedules, right? And in some cases, they have different rates, so they'll be able to see the commercial side of it, yeah? And then the patient makes a booking through the mobile app. And then after that, then they do the online payment. So that first part will provide functions for the online payment as well, yeah? Now that's done, right? Now, during the consultation itself, there are two parts. The patient itself will go into the video call platform. We're using video call in our case, right? But on the other side, what people don't see on the foreground is our doctors will log into the e-medical records in our hospitals, right? So the doctors will see the history of the patient, the previous medications given, right? The previous episodes, right? So after that, then the doctor will prescribe online and send the prescription to the pharmacy. Then after that, the post process would be for the pharmacy to validate and confirm the medication, and then after that, there will be a drugs delivery. So I think looking at the whole thing, there are different technologies required, not only the consultation platform itself, right? But there are a lot of processes and integrations that needs to be done for this process to be performed smoothly, right? So commercially, whether there is an opportunity, I think so, right? If we think about the hospital, there are thousands of hospitals in Indonesia, and if this continues to grow, there'll be needs from other hospitals as well, and there'll be needs to fix inside the hospital, because sometimes, right, the front end part is the easiest part, but the more difficult part is really at the operational level within our hospital, as you can imagine.
Thank you. Yes, very well said. I mean, it just seems like it, to the, to the untrained eye, it's just a video screen, but there are so many aspects of it that you thought through operationally, the user journey, the whole patient experience, especially as patients aren't able to leave their home, to include also the experience that the doctors would have to make it user-friendly on their side as well. So that's fantastic. Thanks for covering that. So let's move on to touch. I think some of the questions coming through the Q&A also might be addressed here. The next question here in regards to some of the regulatory in the midst of COVID. Dr. Jeff, China experienced the impact of this pandemic before most other countries. So at what stage did you decide to set up the telemedicine service, and how did you go about it? And what's the regulatory landscape around telemedicine in China? And have you seen it evolve from the beginning of the crisis to present day?
I think the regulatory landscape in China is relatively well defined, and it was relatively well defined before the COVID crisis. China tends to divide it into two different components. One is teleconsultation, and the other is telemedicine. Teleconsultation, I would describe as giving advice over the phone, talking to patients, seeing if they have a problem, seeing if they need to see a doctor, but not making a diagnosis, not prescribing medication, not ordering laboratories. Telemedicine is different, where you are making a primary diagnosis and you are possibly ordering x-rays, ordering labs, and prescribing medication. So in China, many people can do teleconsultations. You can do that exclusively with a digital platform. Doctors can sign up to the digital platform and they can offer this advice and they can charge a fee for it. For telemedicine, you have to have a bricks and mortar hospital, which is the basis of the home for the telemedicine hospital or the internet hospital. And then you have to apply for a very special license to be able to provide telemedicine services, which would then include being able to make a primary diagnosis, prescribing medications, ordering labs, ordering x-rays, et cetera. The challenge with the laboratories and the x-rays is physicians' ordering privileges are largely restricted to the facilities in which they hold their license. And so it's very difficult to order an x-ray, order a blood test at another facility or for somebody who's in another city. You can still provide the advice, you can still, maybe make a diagnosis, but very difficult to order any tests. For medications, you can order medications and you can partner with a delivery company or a logistics company or a kind of a virtual pharmacy to deliver the medication if you have an internet hospital license. But in terms of actually providing remote, X-ray laboratory orders and services, that's going to be a challenge. In China, there are not many systems that are countrywide where people have access to the hard facilities for those tests where the physicians have the licenses. And this is one of the challenges I think that China still has to address and really focuses on physician licensing being restricted to facilities and restricted to provinces. For United Family, again, we're fairly sophisticated on the patient portal. We're fairly sophisticated on the digital marketing and the digital sales. Where we've been focusing most of our efforts since the pandemic is the teleconsultations. We are currently working on getting a license for an internet hospital so we can do the primary diagnosis and the prescription and the laboratory and radiology orders.
Wow, that's fantastic. All the best in that pharmacy, the hospital licensing. That's fantastic to hear.
Thank you.
Let's move it over to David. Birmingham International Hospital had telemedicine set up long before the pandemic struck, early part of last year, at a time where adoption of telemedicine was still relatively low. Have you observed a spike in telemedicine traffic during the pandemic?
Yeah, we absolutely have. And, really looking back, thank goodness we launched our mobile app in May of 2019. Obviously, 4 or 5 months before that, we had started to work with the medical staff and certainly the administrative and clinical leadership. And so it's a similar experience as well. At first, not many of our specialists were interested necessarily of jumping in and changing their mode of treatment and everything else. But as we all know, the saying, necessity is a mother of invention. So now, with the advent of the culture had started to shift really between May and come up to February and March when we started dealing seriously with COVID. We increased the number of physicians on the service easily by 10 times. We have over 30 different specialties now, physicians that are providing telemedicine and teleconsultation 7 days a week. And then as I think Jeff pointed out as well, for a lot of patients simply, not that they had COVID, they were just a little bit nervous about coming to a clinical space or riding on the SkyTrain or subway to get here and everything else. And so it really has, for us, the volume has exploded and it's morphed into some other very interesting areas that we had not contemplated. Things like home sample collection, home medication drop-off. We actually, last year as well, we opened a retail pharmacy so that we would be in compliant with Thai law in order to basically fill scripts through the app. But at the same point, as Jeff suggested, we partnered with a local Motosai logistics company, but we had several drivers of ourselves that we started doing that. Home flu shots, things of that nature. So it really took off.
Wow, that's fantastic to hear. Really just making it most efficient for the patients during this time of crisis. And Pak Ryanto, would you share the regulatory landscape? What does it look like in Indonesia when it comes to the virtual consultations and diagnoses?
Right. So again, let me separate the world to before COVID and after COVID world in Indonesia. Yeah. So before COVID, telemedicine was still, I guess, in the earlier stage, right, in terms of regulatory, but we are referring to one regulation from the Ministry of Health, right, in 2019 regarding the telemedicine. Now, before COVID, that regulation states that telemedicine needs to be performed between health providers. Yeah, so one health provider to other health provider. So interestingly, I mean, if we talk about telemedicine, we discuss a lot about teleconsultation, but for Siloam Hospitals, our journey into telemedicine started with not with teleconsultation, but with teleradiology. Now, the why we started with teleradiology is because, I mean, if you look at where we are in terms of our network in Indonesia, we have 38 hospitals operating right now in close to 30 different cities throughout Indonesia, right? Now, one of the challenges in Indonesia is that the access to healthcare is not equal. I mean, in Big Island, which is the Java Island, and to the rest of the area, right? So started in 2016, what we've been doing is we set up a unit within our group to do a central radiology services. Yeah. So how it works is we have radiologists in all our network, right, in 38 hospitals of ours across the nation. But as you know, the radiology will need different kinds of specialties and subspecialties, right? So what happens is we've been providing cross-reading and cross consultation between our radiologists across of our different hospitals. So that allows us, right, to provide more specific cases or more complex cases in different areas in Indonesia. Now, after COVID, the regulatory changes. So there is a circular issued by the Ministry of Health recently to allow consultation between doctor and patient and doctor. So that opens the possibility for us to move into teleconsultation in Indonesia. But however, I think there are sometimes there are still, I guess, different regulations issued by different bodies. So other than the Ministry of Health, there is a regulation issued by an organization called the KKI in Indonesian. So it translates literally into Indonesian Medical Council. So it's an organization that governs doctors and regulates the clinical authority, right? And in the regulations, then it states that doctors are not allowed to perform teleconsultation directly to patient without going through health providers. So in Indonesia, in terms of regulatory, I think we are being a bit cautious because there are sometimes different regulations issued by different organizations, and we try to comply with all those.
Very good. Thank you for sharing that, Pak Ryanto. You know, clearly, I think a lot of the questions coming through the Q&A is asking about some of the challenges. And so if we just continue on with this theme or touching some of the areas of that, let me ask David, you know, you've seen telemedicine practice longer than a lot of us. You know, what are the limitations of telemedicine as a whole? And do you believe that there are certain medical scenarios where telemedicine consultations are just not as useful?
Sure. Well, I think one of the biggest limitations, Grace, is that we've had, I think, throughout the world, really a lot of governments and ministries of health, not to personalize this, have been slow to really embrace the technology and provide standards. And I think that's problematic, I think. And as a layperson, I would be very cautious about going into specific diagnosis. But I think direct to consumer, we work obviously very closely with our medical staff, you know, again, as I mentioned, things like conjunctivitis and flu-like symptoms and sinusitis, things of that nature. I'll reflect back. I managed an urgent care chain in the U.S. for the 5 years before I moved to Thailand. We had about 200 physicians, 55 urgent care centers, and our physicians felt like about right at about half of all the diagnoses and all the patients that we saw that could be treated through the telemedicine program that we had. So pretty huge number. So, you know, again, I think it's going to, post-COVID, it's going to be interesting to see how this all shakes out and everything else. Again, there's, you know, physicians on the conference, I think they can probably speak a little bit more specifically to diagnoses.
Yeah, I think if I can jump in, I think that perhaps one of the most significant challenges is that as a physician, you're not able to touch the patient. You're not able to feel the patient. You're not able to listen to the patient. So making a primary diagnosis is difficult and is fraught with risk through just a video interface. If it's a secondary diagnosis or follow-up for chronic primary diagnosis, I think, is particularly challenging. I think this will get easier as remote devices and wearable devices get more sophisticated. So, somebody has an Apple Watch and we can look at their cardiac tracing, or we can put a blood pressure monitor on, or we can look into their eye and see their retina, listen to their lungs, maybe through a kiosk or something, or through wearable devices. And I think that's just around the corner. By that I mean, 3 to 5 years, and that should be relatively readily available for some people in some instances. I think another risk that we haven't talked about, which is of significant concern to me, is documentation in the patient's record. So a lot of people are providing these telemedicine consultation services. A lot of people are documenting in the platform. But that document form doesn't make it into the patient's medical record. And from a continuity of care perspective, from a patient safety perspective, from a clinical quality perspective, that's concerning. As a hospital administrator, I think that JCI is going to be very, very interested in how we translate from these, from the telemedicine to the EMR. And I don't think JCI has figured it out yet either, but this is something that they're absolutely going to have to pay attention to. If our doctors who are using our brand at our facilities are providing guidance and consultation to patients and possibly prescribing medication, then that has to go into the EMR. And if we're not doing that, I think that's going to be a big problem from an accreditation perspective.
That's a very good point. Especially since the onus is on the doctor to be able to do that proper documentation. If you have these fragmented systems that just aren't interoperable, it just makes it so much more confusing and difficult for anyone to truly adopt this type of technology and use it for their advantage.
And doctors really don't want to go from platform to platform, from one app to another and document across. So I think it's a big challenge.
Yes, you're right. Let me, Dr. Jeff, if I could just stick with you, there's a lot of data that shows that for nearly 2/3 of the cases that, patients finally have to see the doctor in person anyways, as you mentioned, a lot of these cases are what's appropriate for telemedicine is those in which you don't physically do a physical check with the patient. So we see that the virtual consult was not possible. Have you found an effective way to triage? So it's providing value to the patient every single time they come through the telemedicine platform.
I think in terms of triage, you have to rely on the physician's clinical judgment. But I think the physician should be less confident in their judgment when doing telemedicine. So if the physician is going to err, they should err on the side of patient safety and not on the side of, oh, don't worry, it's going to be okay. If there's any doubt, the physician should probably say, I think it's probably this, but I'm not certain. I think maybe you should come in, or maybe you should see someone. From a business perspective, what we have found is that there are basically 2 categories of patients, and they're subcategories, but there's 2 categories of patients. There are new patients and there are existing patients. Our existing patients have about a 70% conversion rate to in-person consultations after a telemedicine consultation. The new patients, however, have a much lower conversion rate. In part, that's because a lot of people are now accessing our system outside of our catchment area. So they may, we have hospitals in Beijing, Shanghai, Tianjin, Qingdao, Guangzhou, but we don't have hospitals in Chengdu or Chongqing or Wuxi. And patients are accessing us from far away, very remotely. And they're not going to access our system unless they're coming to see a subspecialist for a very specific problem. So for the remote patients, the conversion rate to a physical consultation is much, much lower, at least within our system. They may be going to a local provider after talking to our doctors, but we don't see that.
One of the questions coming through here is really about the hallmark of medical consultation is the human touch. Can you build that mutual trust in a virtual consult? Jeff, did you want to follow up on that comment?
Sure. I think it's hard. I think people are getting used to the kind of the virtual interaction, and people want to give people the benefit of the doubt in terms of having integrity and being honest and having their best interest at heart. But it's very hard to replace that personal touch, the shake of a hand, the hand on the shoulder, the listening, the feeling. I think it's much easier if you have an established relationship with the patient to then go virtual than it is to develop a warm, trusting relationship with somebody only virtually.
Right. As a follow-up for like the chronic conditions and whatnot, as a follow-up. Very good. Thank you for sharing that. In terms of some of the other challenges, what's the state of progress in collaborating with the payers on reimbursement for your telemedicine solution? Pak Ryanto, it sounds like you have the cashless system put in place as well. So maybe you're just quite far, in allowing patients to have that seamless experience, such as those cashless payments. So it's just really a turnkey solution. Would you be able to share, is that, Siloam being the forefront of doing so, how difficult is that, and, state of progress of making that as part of the status quo throughout?
Right. So it's not easy, Grace. So it takes a lot more effort, again, on the background. So in Indonesia, the landscape is, there are different kinds of payers. Yeah, one is the bucket we call out of pocket. Yeah, and then there is private insurance. There is the government insurance, the BPJS in Indonesia, the national, the universal health coverage. And then there is also the bucket of corporate payers. Yeah. So as we discussed, the out-of-pocket is pretty easy, right? So we just provide different kinds of online payments, whether it's a credit card or debit card or e-money, right? That's done, right? Now for the corporate payers, what we're doing right now in our network is we use a mode of payment that we call a voucher, right? So the system will generate voucher codes, right? Then based on what we agreed with the corporate clients, then we can generate the voucher codes for their employees to be able to go onto the platform to do teleconsultation. So they use the voucher code. That means they don't need to do a cash basis payment. We'll take care of the reimbursement to the corporate later on. Now for the insurance, the private insurance, it's a bit more tricky. So I think we need to see whether the insurance is the indemnity type or the managed care, right? The indemnity type would be slightly easier, I would say, right? But we need to build some kind of a system integration between the provider and the insurer, right? To check the eligibility, to check the platform, the limit of the coverage, right? To check the cases that would be covered versus not, those that would not be covered from the insurance side. From the government side, so far, the government in Indonesia has not reimbursed the teleconsultation. So that's where we are.
Very good, thank you. I also see a question coming through in regards to quality. Pak Ryanto, if I could just, if you could follow up on this. In terms of, you provide the full suite of service to even deliver medicines to people's homes.
Right.
And, do you have any comments to the questions in regards to ensuring the quality of the medicines as they go home?
The medicine, yeah.
Right.
Yeah. Yeah, so again, as providers, I think we all agree that patient safety should be the number one priority, right? In Indonesia, there is what we call the 5 correct guidelines for medication, right? So we need to ensure that it's given to the right patient, to the right person, right? The right dose, the right usage method, and all that, right? So what we're doing is we establish a protocol, right, in our hospital to ensure that these 5 guidelines, 5 correct guidelines are being followed properly, right? So when the medicine is packed, for example, we need to pack it properly, right? So it's not a transparent packaging that the delivery courier can see through, for example. And we also limit the kinds of medications that can be sent versus those that cannot be sent. We're very careful with anything related to narcotics and psychotropic drugs, right? And also drugs that will be sensitive to I guess, to temperature and all those. So we have guidelines inside of our hospitals to ensure those are not being delivered by courier, right? And then once the drug is delivered, we have a protocol for our pharmacy to give a call to the patient to ensure that he explains all these 5 right principles. Yeah.
Great, thank you so much. That's very helpful to just do the compliance so it comes without any issue to straight to the patient's home. I'm seeing quite a few questions coming through the Q&A in regards to personal data and security. So let's move on to that topic of discussion. Dr. Jeff, if I may ask you, the research shows that health tech companies are one of the top targets of hackers to expose data. What are some of the security measures you're taking to give confidence to doctors and patients about your telemedicine platform?
Well, I think in all honesty, you don't only have to worry about hackers. We found not just colleagues that I've spoken to in other systems as well, in other countries as well, have found that patient data can be valuable. And sometimes you may have employees selling patient data to vendors. You may have vendors selling patient data to other vendors. We even have instances, I've heard of instances where government officials who have access to the data are then selling it to vendors. So there's a lot of ability for the data to get around that is very, very difficult to suppress. So I think from the very, very beginning, you have to have very clear policies and procedures. You have to have a very clear ethos that you communicate to all of your staff that, we are basically HIPAA compliant. Patient data, patient information is purely confidential. You can only have access on a need-to-know basis. You only discuss on a need-to-know basis. Then once you do that, you start talking the systemic controls. So you have all the normal IT data security stances. You have limited access on need-to-know basis. You have authorization for greater access or lesser access. But still, one of the problems that I find with healthcare organizations is they're very mom and pop. They're very local, and they aren't IT companies, right? They're healthcare organizations. So our IT systems and our IT knowledge is generally not state of the art. It can be very, very good. It can be very robust. We have, some very good IT experts, but we're not IT companies. And this is an issue that has been kind of impressed upon me by several of my IT colleagues, that no matter how good we think we are, or no matter how good we try to be, there are IT companies that are purely focused on it that are going to be better. And the reason I'm saying this is that at some point, I think most of us are going to have to consider whether or not to migrate our data to the cloud. And for a long time, I was very hesitant to do that because I didn't have a lot of confidence in the data security of the cloud. But I think the cloud has matured a lot over the last 3 to 5 years. And I think if you choose the right cloud partner, they are experts. They base their entire business on data management and data security. And it's probably a safer place to keep your data than in your own servers. Now, you'll hear IT arguing that if we go to the cloud, then we can save a lot on CapEx. And that's very, very true. But you're also probably going to increase your OpEx. So the cash outflow may decrease for the first year or 2 or 3, but eventually your operating expenses are going to increase, and the amount you spend in OpEx is going to be more than your CapEx. So the net savings may not actually be realized, but I think the data security at this point may warrant people seriously considering migrating from their own personal servers to a cloud-based solution if you pick the right cloud-based partner.
Thank you so much. That was actually quite helpful, I think, for many of the hospital audience members who are, looking or considering, do we actually, what are the considerations on a security standpoint? And also, do we do it in-house, or do we partner up with another company in which they are focused and experts in this? I agree with you. HIPAA guidelines is a guideline to be able to help ensure that securing data privacy is in check, the guidelines through that. Just some of the comments in terms of data is the highlights. It's encrypted in transit. encrypted at rest. The system as a whole has a role-based access, complete with a robust audit and two-factor authentication. So these are just some of the areas that some of the qualifications to ensure quality as well. Thanks so much.
Grace, can I add to
Sure.
that topic? Yeah.
Please.
So I think when we talk about the data security, I mean, for the benefit of everyone present here, especially colleagues from other hospitals, yeah, the data privacy is one issue, right? But I think many of us here will remember the ransomware attack in 2017 called the WannaCry, right? It affected many industries, including hospitals, including some of the hospitals in Indonesia as well, right? So what happens is it locks the data in our database, so it cannot be used. Now, if you think about it, right, in a hospital where more and more of our processes are being done online, that's actually a pretty scary scenario, right? So if we cannot access the patient data, if we cannot access the medications being given to patients being admitted to our hospitals, right, we actually cannot do, we cannot operate our patient care, cannot give our patient care effectively, right? So yeah, I agree. I think the data security is something that we need to start immediately.
Thanks for adding to that, Pak Ryanto. Very good point. Very important throughout. I think that address some of the questions that have come through our Q&A. Maybe just touching upon that and going more into the customers who actually use our telemedicine platforms. David, do you think that regulators will allow cross-border telemedicine? And is this a greater opportunity or a threat to the existing business?
That's a really tough, it's a tough issue, not only in Southeast Asia, but across the world. You want to think that eventually, yes, necessity again will make that the mother of invention. I agree that whatever we do, it's got to be in a secure environment. It's the same in the United States when you've got 50 states in Puerto Rico and Washington, D.C. Very few states have instant reciprocity with physicians. And so it's very challenging. But technology obviously is ahead of where we have been from a licensing and credentialing perspective and everything else. I think I agree with Jeff. I think that in the relatively near future, I think the COVID pandemic has opened a lot of eyes to what the potential of this is all about and the real advantages of cross-border care. And I want to say one other thing too. I absolutely agree with one of the points that Jeff made about, I think that it's essential for physicians and other caregivers, whether they're dietitians or physical therapists or whatever, to document in a common EMR. If the hospital, if the caregiver has one, I think that's sometimes some of the mobile apps have it. And if there's the ability to have that PDF'd or actually through HL7 or whatever, to have that record, that summary go right into the EMR, I think that's absolutely critical right from the jump. And not only for the continuum of care, but for liability reasons and a whole lot of other things. So.
Thanks, David, for covering that. I see that as some of the questions coming through in terms of the liabilities. So that was very well covered. Thank you for that. In terms of focus then on the customer side, Pak Ryanto, just to better understand who's using telemedicine, would you be able to share any of your demographic analysis on your using? Who are these patients that are actually using the platform?
Yeah. So again, this is still very new. So 3 months in operation, Grace. So this may change, right? But from what we see in the past 3 months, interestingly, if we look at the demographics, yeah, 80% of our customers that are coming online using the teleconsultation are actually age 40 and below, right? So maybe it's because of the technology literacy as well, right? Or maybe in some cases because of a cultural issue. In the beginning, when we started this, we spent a lot of effort convincing both our patients, but also our doctors, right? That this could be a feasible solution for some cases. But after usually what we observe is after going through once, yeah, usually they're comfortable with it. But the first try is the most difficult for our doctors and our patients. Now, the other part that we see is based on the teleconsultations that we have done in the past 3 months. We see that 80% of the patients coming through were existing patients of ours, right, previously. So I think that is consistent with what we discussed, that it's easier for this teleconsultation to be done, not for establishing the initial diagnosis, but to continue the treatment, right, in a chronic case, for example. But there are 20% of the patients that we see are new, and some of them are coming across the region in Indonesia from different cities. So, I mean, if we think about it, that could be an opportunity for us providers in the future as well to increase our reach in the country.
Very good. Thanks so much for sharing that, Pak Ryanto. Just as we have the last 9 minutes of our webinar together, let's look out into the future. You know, beyond COVID-19, what do you think the future of telemedicine looks like? Do you think that it will continue to remain as popular among patients and doctors, or actually go back to pre-COVID-19 stage of adoption, or perhaps it's going to be somewhere in between? Maybe David, would you like to take that question?
Sure. I think that from the existing COVID time, I think it's gonna the volume in the near term is gonna drop back. But I think I agree with Jeff on this one too. I think that we are on the cusp of having home monitoring and wearables, that whole market, and with that data integrated into our EMR, it's about ready to explode. I really am bullish on that whole space. And I think that the COVID, that whether it was social distancing, whether it was quarantine, I think has really allowed the masses to see that this is not as necessarily as good as having a doctor lay hands upon. But given the circumstances, and you know, we need to remind all ourselves, we live in an Insta culture today. We live where people push a button, they get a movie, they get a coffee, they get Food Panda, a Motosai shows up to drive them. And so we all have an expectation that that's going to happen. And I think the COVID pandemic has allowed a lot of the world to understand that telemedicine can meet some of that immediacy need, if you will. So.
Very good, thank you. Pak Ryanto, do you agree with that as well?
Yeah, I think Grace, like I mentioned earlier, I think this is about as any disruption or any new trend or any new technology, this is about cultural change, right? So the first period would be the most difficult. But once we hit a tipping point, like what David mentioned, we will need more of, say, the remote monitoring devices. We'll need to figure out how to do communication better in this online world, right? But once we sort out those, I think the adoption will keep increasing.
Very good. Yes. All right. And then just looking at the big picture in closing, you know, what's the next innovation you'd benefit from, whether within telemedicine or a totally new digital health innovation in your strategy that will help you develop a fundamentally more efficient and resilient health system? Dr. Jeff, would you like to take that?
Sure. I agree with everything that everybody has said. I think telemedicine is here to stay. I think wearable devices are the wave of the future. I think that the impact on the healthcare system will probably be a fundamental shift away from face-to-face or in-person primary care. I think that as people get more and more comfortable with it and wearable devices get more and more prevalent, then they'll probably do more and more digital consultations for kind of the healthy sick. So people who aren't very sick, people who have chronic disease management issues, people who just have a cold or a cough, I think that will probably impact primary care significantly. I think hospital or healthcare systems who don't get on board with the digital health wave are probably going to find themselves behind in 3 years, in 5 years, certainly in 10 years. I think that on the advanced care, the subspecialty care, the tertiary care, there won't be any negative impact on the hospital systems from telemedicine. I think the impact will probably only be positive. We'll be able to extend our reaches. We'll be able to do more advisory work for satellite hospitals or remote site hospitals, and we'll be able to increase our catchment. Patients who need surgery are still going to need surgery. Patients who need oncology are still going to need oncology. They're still going to come into the hard bricks and mortar hospital. It's the healthy sick who are going to be less and less inclined to come in and more inclined to access the digital services.
Very good. Thank you, Dr. Jeff. I think maybe I can squeeze one last audience question in. I'll pass this over to David. What are your main criteria for selection of vendors regionally, such as laboratory imaging centers, clinics for physical examination?
I'm not sure what the nature of the question is specifically. So if we're doing a visit with somebody and they need to go, well, we have Bumrungrad has a network of hospitals we collaborate with, we don't own and don't choose to own throughout Thailand, specifically in country. And we would encourage patients if they needed that kind of level of treatment, whether it was an MR, CT, some kind of lab work. At that point, they really need to establish a relationship with a local physician closer to where they are to go that. But we would refer immediately from a geographic perspective to the hospital closest that we have a working relationship with. And that system works informally around the world. I think that's an unselfish process to go through. We don't have, there's not a network of independent laboratories and imaging centers and surgery centers around Thailand at this point. So.
Very good. All right. So in closing, let's do it in rapid fire, 30 seconds before handing it back over to Pinky. For those in our audience who may still be on the fence to implement a telemedicine feature, what advice would you give, or would you like to, or if not, any advice you would like to share as a key takeaway from our hour together? Let's start with Pak Ryanto.
Okay, thank you, Grace. So I think all this discussion about telemedicine and this COVID, I think what it does is it's forcing us to rethink, right, of all the services that we are doing right now in our hospitals, whether those needs to be done in the hospitals or can actually be done outside of the hospital walls, right? So home care is probably one area we should explore, right? And patient remote monitoring is another area. And also I believe that in the future, the patient care should be more collaborative between patient and the provider, meaning there should be a more tight communication between the hospitals and what's being done outside. That's my point, I guess.
Thank you, Pak Ryanto. Jeff, Dr. Jeff?
Sure. I think that particularly in this environment of cash flow crisis, where every business is being challenged by decreased revenue and is really having trouble managing their EBITDA, it's easy to try to do more with less. The problem is regarding digital health. I think it is so important and to the future of healthcare, and we're really at the inflection point. I would seriously recommend that people consider getting an extra budget allocation for a digital health initiative outside of your normal budget. So put together a task force and say, we need this number of staff, we need this number of CapEx, we need this amount of SG&A, this is our business plan. It's going to cost us, $250,000 a year or, $1 million over the next 3 years. And this is our digital health strategy. Go to the CEO, go to the board and get it approved. If you try to do it with your existing resources within your existing budget, I think you'll find yourselves continually constrained and falling further and further behind the power curve.
Wonderful. Thanks, Dr. Jeff. David?
Yeah, the one thing I would say if a hospital's thinking about this, that if they continue to think about it and not taking action, as Jeff has aptly outlined, I think they're going to wake up and ask the three-word question in a relatively near future of what just happened, right? I go back to the first quarter of 2019. There was not one hospital in all of Thailand that was providing telemedicine as far as direct-to-consumer telemedicine and telehealth. And you know, that's changed. The whole landscape has changed in just a very short period of time. And we continue. We have a handful of little posters around the hospital where we remind ourselves all the time at Bumrungrad, it's not the big that eat the small, it's the fast that eat the slow. And we have to have a sense of urgency. But again, not to approach it cavalierly, take data security very, very seriously, take centralized charting and everything very seriously. But I think it's critically important to listen to today's consumer, and the consumer's pointing the direction that this is something that they want.
Thank you. Thank you to our panelists, David, Pak Ryanto, and Dr. Jeff, for generously sharing your expertise on this topic, especially as we accelerate adoption of digital health solutions to support patients where they are searching today, which is online. And thank you to Pinky Faduyan and your teammates, Trina and Rose from Clarion Events, who have worked hard behind the scenes to set up these events to discuss important topics under the Hospital Management Asia to support doctors, hospitals, and other stakeholders have joined us here today throughout the region. So thank you. Pinky, back over to you.
Great, thanks very much, Grace. That was awesome. I mean, even keeping to the time as well. Thank you so much. And thank you, of course, Dr. Jeff, Pak Ryanto, and of course, Mr. Boucher, David Boucher. Thank you. And just before you all go, we have another poll. Exactly, we want to find out just how many of you will be setting up or improving your telemedicine or telehealth portal. Yes, within the next 2 months, within the next year, within the next 2 years. No, we already have one and it's working well, or no, because it's not applicable, or no, you're just not interested in telemedicine. Okay, just waiting for everyone's votes to come in. But before the results come up, I will show you a slide after this. Do join us for the wearables diagnostics webinar in July, which is really in line with telemedicine.